Hey yo, hey, welcome back to my channel. Today we're going to speak on a highly misunderstood topic, and that's how Ehlers-Danlos Syndrome, or EDS, affects women, particularly in health. If you or someone you love suffers from an EDS, or is dealing with it, this video is definitely for you. Let's go ahead and break this down. Ehlers-Danlos Syndrome is a group of connective tissue disorders that can affect the skin, joints, and blood vessels. I have a whole video on the basics of EDS, so it often leads to hypermobile joints, fragile skin, and in some cases, complications with your internal organs, because that's what's holding them in place. This is due to a defect in collagen, a protein that provides structure to the skin, bones, vessels, and other tissues. While EDS affects both men and women, many women experience unique challenges. For instance, hormonal fluctuations during menstruation, pregnancy, and menopause. That's lifelong. Can be exacerbated. EDS can exacerbate your EDS symptoms like joint pain and fatigue. Women with EDS are also more prone to pelvic organ prolapse, chronic pain, and gastrointestinal issues, which are often more intense due to the connective tissue problems. Managing EDS during pregnancy requires a collaborative approach between your obstetricians, geneticists, we touched on this, and other specialists. Prenatal care should focus on monitoring the mother's cardiovascular system, as blood vessel fragility can be a concern, and ensuring the joints and muscles are supported with physical therapy. Regular checkups and customized birth plans can help reduce risk. I have a very good example. When I was pregnant with my daughter, I experienced severe hip pain, and I had already injured my hip, fell off the wing of an aircraft. It's a whole nother story from my Veterans Chronicles. But long story short, when I came back to the US, they found that my ligament, that's when I was officially diagnosed with EDS. They found that my ligament didn't grow, like it didn't stretch back, and because she was so heavy, that caused some issues there. She was my big baby. That experience led to hip surgery. I had a lateral tear and debris, and anyone knows when you have an issue that happens with the joints, you can kind of hear it because it echoes through your body. And I dealt with that. Ew, I got something in my teeth. Then you deal with it, okay? Sorry, y'all. That being said, after pregnancy, recovery can take longer for women with EDS due to the body's slower healing process. Pelvic floor dysfunction and organ prolapse are more common, so postpartum physical therapy can be crucial for a healthy recovery. Breastfeeding can also present challenges due to joint pain or fatigue, but it's important to have a supportive network to assist with these challenges. I unfortunately did not have that network. I lived in Europe when I was pregnant with my children and gave birth to them over there. So, there was just so much going on, and it's a hot mess. So anyways, let's get back to some more facts. Mental health. everything in your body affects your mental health, all right? And it's highly important for women with EDS to also take care of their mental health. Dealing with chronic illness, especially during and after pregnancy, can be emotionally challenging. Um, you know, we it's now known that there's postpartum depression, and that's real. So you want to make sure you definitely go to counseling, support groups, and use stress management techniques like meditation. They can provide relief. Thank you for watching. And if you or someone you love is managing EDS and pregnancy, let them know that they're not alone. You're not alone. Try to stay positive. I know you're dealing with pain and all the other symptoms that come with the disorder, but there's a light. There's a light, and that's through management. Don't forget to like, subscribe for more in-depth insights. All right. Have a beautiful day. Love, peace, and joy.